Today we are going to discuss pregnancy and the Crohn's disease. Unfortunately, in some cases, you may be faced by a pregnant female with a Crohn's disease and start a pregnancy without planning or even counseling. In such cases, we have to ask two questions. The first, what is the medication during the pregnancy which can be used safely? First, we have to stop methotrexate as it is very toxic for the fetus. Usually, methotrexate have to stop about 6 months before getting pregnancy. Otherwise, can continue all the previous medication. ECO's statement 11/2010 mentions that medical treatment for Crohn's disease except methotrexate should be generally continued during the pregnancy because the benefits outweigh the risk of the medication. So, in some cases, you have to continue some of the antibiotics or 5-amino-salicylic acid, steroids, azathioprine, cyclosporine, tacrolimus even, but you have to stop methotrexate at all. This is regarding the main treatment. What about the safe symptomatic treatment for this patient? Safe symptomatic treatment, the following are safe during the pregnancies, like metoclopramide, vitamin B6, ondansetron, and antacids. Also, saccharalfate and H2 blocker antagonist and certain types of PPI, I mean, especially pantoprazole, codeine. Also, all of these can be used safely during the pregnancy. We have to stop non-steroidal and aspirin and cholestyramine can be probably used loperamide, but without diphenhydramine, as diphenhydramine is toxic for the fetus. This is the first question. We have to discuss the medication. Some of them maybe have a risk. We measure the risk benefit for the patient. The second question we have to ask, what is the course of the disease during the pregnancy will be continue? If the course of the disease is quiescent and the patient is good, the risk for the relapse after delivery is 1 every 3 cases over 6 to 9 months. But if the patient during the conception developed active disease, majority remain active during the disease, unfortunately, during the pregnancy, and the indication for the surgery in the pregnant women with the Crohn's disease are the same as non-pregnant: obstruction or perforation, hemorrhage, multiple abscesses, perianal abscesses. All of these are equal to the normal personnel without even pregnancy. And severe ill patient, continued illness is greater risk for the fetus and than the surgical intervention. So we have to measure usually the risk benefits for surgical intervention if we are decided to start this IBD in algorithm. Goodbye.